Hello to everyone. I'm Sabrina Licata, skin expert at Bella Aurora, the laboratories who have created Repigment 12. Today we are here to clarify your doubts and answer all your questions about Repigment 12 and to get to know more about Dr. Matteo Bordignon. Good afternoon, Dr. Matteo.
Good afternoon, Sabrina, and good afternoon to all the people watching at home. It's a pleasure to be here with you this afternoon to show you some results and to solve your doubts if you have any.
Yes, I have to say that it's been almost 1 year now that Repigment 12 has been launched in the market. And we've been receiving, and you as well, results from all over the world, from different countries, different cultures. I just want to know, how does it make you feel?
Yes, it is. I feel very great because it's the dream of every researcher to can achieve this kind of results, to start from your own idea, to have the possibility to make a research on it, to develop, and to see the results on the people's skin. It's a sort of dream that come true, and I'm very happy to see that every day more results come to my vision, and the people are really changing their life using this product. It's very satisfying for me.
Very interesting, and it's very important for us to know that thanks to Bella Aurora, they achieved this result. And I would like to know something more about the phototherapy, because we always say that it's very important to do phototherapy for obtain the repigmentation, the complete repigmentation of the skin. It's something super important, right?
Yes, phototherapy is mandatory tools for giving this kind of treatment, because you have to remember then when you have the white spot patch appears, the cells in the spots are completely gone. They are normal cells. And so when we remove the block on the spot with the Repigment 12 cream that eliminated the MIA protein, you have to stimulate in some way the replication on the melanocyte. And we know that the best way up to our knowledge, is to use an ultraviolet rays that can become from the sun exposure or the photo treatment, both UVA or UVB.
Okay, this is very interesting. So all of you probably are watching us right now. Remember that it's very, very important to do a sun exposure or phototherapy to obtain the complete result. Now, if you are okay, we were mentioning some of these results. I would like to see some of these results, if it's possible.
Yes, okay, it's a great pleasure. This one of the mouth, as you can see, very good. I can say also my complete pigmentation in 6 months. In this case, the person do the sun exposure and a little bit of phototherapy, because we have to remember that it's very good to do the sun exposure, but when it's winter or if you have no possibility to be sun exposed, you have to replace the UV exposure with a phototherapy. But there are other cases. For example, in these cases, in only 3 months, we have a very good, I can say almost complete repigmentation. And it's very interesting to see the different stage of repigmentation. In some photos are very detailed, so the patients are very kind. They send to me all their progression to joy with me of their progression. And so we can solve all the different parts. But we have to remember that every patient has his own timing of response. You can be faster, you can be a little bit slower, because it depends on your biology. This example, for example, we are going to see the same part with different timing of response. This is the part of the eye. For example, in these first images, we can see the patient that responding 4 months, almost a complete repigmentation. Whereas in this other picture, the same results is being achieved in 6 months, so more timing. But in this other one of the similar results has been reached in 1 year. So everybody would like to have a very quick, fast, and complete results, and we are working to let the patient have this result as soon as possible. But sometimes we have to remember that our own biology requires different times. So one is more easy to get the melanocyte stimulation, some other one take more time. But the important thing I always say is the results. If we have a complete result like that in this picture, you can also take 1 year, but at the end you are happy to have it, of course. Then we can have also other results. For example, this one of the scalp is very interesting. In this case, just with sun exposure, because this person that did this treatment during the summer, a very sun exposed area. So in 4 months, for June to October, he has these very good results. This some other one, this is a very good results, very nice result of the chest. You see, chest is a quite difficult part to have repigmentation because it's not much sun exposed. The skin is little bit thin, so it's sometimes not easy to repigmentate the area, particularly like in this picture, if you have very big spots. With big spots, the treatment work anyway, we can say with our great happiness, because as you see, in 6 months, more or less, this person achieve more than 50%, I would say 60 to 70% of repigmentation in that very difficult area. And then other cases, for example, in arms are very good target for our treatment because it works very well. Also because the arms are very full of hair follicles, which we know is very mandatory, which is very important for any repigmentation. And so also in few months, in 4 months, with the help of phototherapy, also in this case, which remember is very important to achieve these results so fast, we can have a complete repigmentation. But other cases very interesting. For example, hands. You know that hands are commonly believed to be the most resistant site. Hands, feet, and we know that are more difficult parts, but as you can see in this picture, they are not completely impossible to achieve repigmentation in this part. These very nice results always obtained with the use of sun exposure and phototherapy to have the repigmentation almost of 60-70% of the upper part of the arms. This is a very good results and make the patient very happy, and me and all the company too, of course, because in other situation and using other treatment, it will be very, very difficult to achieve these results. But again, we can see another results in the 4 arms, for example, almost very good complete results. And this is very interesting also because we can see, I repeat, even if you have large spots, and large spots that does not respond to nothing so far, you can have results using Repigment 12. Like in these cases, this is one of the most fastest repigmentation. In 3 months, you almost have a complete repigmentation, but it's due to the fact that the people respond very well. Other person can take 6 months, as we told before, 8 months. The important thing is to be constant, to be continuity with the treatment, morning and evening, applying the cream, and to have a good phototherapy or sun exposure schedule, followed by most of all a dermatologist or anyway an healthcare professional to make sure that the treatment is safe for your skin and to have your results. And this is one of the last results I would like to show. This is a man who have this very big depigmentation around his mouth, and you see how good repigmentation she had. I can see almost complete that. I'm in touch with this patient and I saw down the repigmentation now complete. So we are very happy to be say mission complete. And we hope to can say mission complete to a lot of persons around the world, of course.
Congratulations to you, first of all, and congratulations to all of you for this amazing result achieved. It's important to us to know that thanks to Repigment 12, you feel comfortable in your skin again. So now I will start answering the question if you're ready.
Of course.
I've had white patches for 15 years. Will repigment's result differ depending on the time I've been suffering with white patches?
This is something that we also was very surprised when we do our trials. The results of Repigment 12 is not depending to the age of the spots. So, or you can have a very recent white spot, or you have a very old white spots, also more than 20 years, and the response rate is more or less the same. So you can repigment in very few months. It's like something that these spots have been blocked for here, and if you remove that block, in the sense that you can let the melanocyte go into the spots and repigment it. So the answer is no, you have to don't worry about it. If we also have an old white spot, you can use Repigment and you can have the wonderful results as we shown before.
I tried all the treatment and I haven't noticed any result. Why Repigment might help me? What makes it different?
Yes, this is very commonly a question asking to me, but we have to underline that Repigment 12 is a completely different treatment. The mechanism of action was completely unknown until 10 years ago, and this is totally completely different from all the products that a patient could try so far, because he tried mostly drugs like steroids or calcineurin inhibitors or other compounds like irritant, like kaolin, piperine, or something like that. In this case, we act directly to the core by using a sequence of amino acid, like this peptide, with no pharmacological action, is able to penetrate into the skin, go into this particular layer, which is the basal layer, and blocking the protein. So this is something never discovered so far, and the product is already demonstrated to help all the people that were resistant to other treatment.
Okay, and I have to say also that we don't have any side effect with Repigment.
Of course.
This is important to
specify. Of course. The nature of the product, since it's just a chain of amino acid, is impossible to have side effects. So far.
Because so many people contact us asking if there are side effects.
It's a safe treatment for every area in our trials, but also in this first month of marketing, we have very lot of people reach of the product. The safety profile is still at the maximum level at all.
Perfect. Thank you for your answer. I'm gonna read the second one. If I use the cream without phototherapy, will I have the same result?
Not so much, because if you apply the cream in sun-exposed areas, you of course can have results because you do a sort of natural phototherapy. If you use, like we see, you remember the patient with a scalp, it doesn't perform phototherapy and have a very nice result. So if you have very sun-exposed area and you live in very sunny areas, you can surely have results using natural sun. But if you have in a sunshade area, like in the body, in the arms, to have this kind of results, you have to perform phototherapy.
So it's necessary, more or less.
It's necessary, for sure.
The next question is, if we can use Repigment 12 on genitals?
Yes, Repigment 12 has been tested for all the areas of your body. So you can use from the normal part of the skin, also in the most delicate part, like eyelid and also the genital areas. Of course, with the genital areas, you have to be very careful with the phototherapy because this possibility, you can do it better localized, but you have to be careful because the risk of burning is more high than in other regions. So you can apply the product, but the recommendation is to be followed very strictly by a dermatologist for perform phototherapy in that area.
Yes, because I have to say that so many people contact us on daily basis saying, can I do on genitals, but can I do alone without dermatologists following me? So the answer is no.
No, it's better to avoid
Absolutely no. Okay.
Because the characteristic of this area.
Okay. How do I have to use the cream Repigment? If we can explain how to use the cream.
How to use?
Yes.
Yes, the usage of Repigment is very easy because you just have to apply the cream on your spots morning and evening, and let pass at least half an hour before washing or make water on the part or apply other products.
Sorry to interrupt. So you said half an hour, right? Because
yes.
Some people say 1 hour, some people 45. They're not sure about how much time do they need to wait.
Half an hour or 45 minutes is okay because it allows the peptide to completely penetrate and not be absorbed by the other agent, like the one that you can find in other creams or in something like that.
Okay, once we finish applying the cream, can we apply other product or we need to wait, or we can apply any product like makeup or sunscreen?
Yes, some products can be applied immediately. For example, the makeup or the sunscreen can be applied immediately. Whereas the product that can be absorbed, like other cream for the face, it's better to wait for 30 to 45 minutes.
Okay.
That's why the important thing is leave the peptide alone to be absorbed correctly in the skin, and so not to put other ingredients that can interrupt this process.
Okay, perfect. How I use Repigment 12 during the winter?
You use like in summer, you keep applying in the part morning and evening. You can add phototherapy as we said, because during winter there is not sufficient level of sun exposure.
What we said before.
To hope to have an effective repigmentation. So it is better to add, particularly during winter, some session of phototherapy.
Perfect. Okay, thank you. Can Repigment 12 be used with the other treatment as well?
Yes, this is also something commonly asked. You can add the Repigment 12 to other treatment if you want, of course. I cannot recommend it to do a mixture of treatment by your own, by the patient. But if they are followed by a dermatologist and they want to combine different treatment, they can do it. Because for its nature, Repigment 12 does not interfere with any other treatment. It's better always to put it before the other treatment, but then you leave half an hour, as we say, and you can put other treatment.
Perfect. Okay, but Repigment 12 always the first.
Repigment first, as you can say.
Perfect.
Very easy.
Okay, they ask if we can use, if we need to use sunscreen when we do UVA and UVB. Do we need to use the sunscreen?
No, our suggestion is to not use sunscreen if you do phototherapy, UVA and UVB, because it can interfere with the correct absorption of the UVB ray. But for this reason, we strongly recommend to add an oral antioxidant, like Repigment Sun, for example, because it strongly raises the antioxidant property of the skin. So it's a sort of natural sunscreen you have taken by inside. So the important thing when doing phototherapy is to proceed slowly, to start with a slow amount of doses and then rise it little by little until to reach a full doses. In this way, the skin, is not getting burned, and you can have the better results.
Of course, thank you. Okay, the next one is, I wanted to wait until summer, but do I need to continue applying the cream? Because some people, maybe at the moment, they're not doing phototherapy, so of course they are not seeing the same result that they see during the summer. So do you recommend to interrupt the treatment and then continue during the summer? Or, I don't know.
No, it's better always to maintain the treatment because the treatment has also a preventive possibilities. You can do to apply the cream, and the cream also prevent the formation of new patches. Moreover, if the skin is already prepared with the cream, you can easily and usually respond faster and better during the summer. So the best way is to maintain the application during all the year. And if you cannot perform phototherapy, you can apply anyway the cream and waiting for the sun exposure.
We still have so many questions to answer, but unfortunately we're running out of time. If you have any more questions, you can ask me or the other skin expert by going on our website, bellaurora.com. You can select an appointment by the section White Patches by your side. Then you can book an appointment for the time and hours that you prefer. I want to thank you to be here with us today. It was a pleasure. Thanks for answering all the questions and clarify your doubts.
Thanks to you. Thanks for inviting me. It's a pleasure to be with you and with all our viewers. And I hope you could have a good treatment and let me know your results.
Thank you all of you once again for trusting in Bella Aurora. Have a good evening.